Here are 5 tips on Medicare Part D prescription drug coverage. Click here to learn more. Let's talk about it. Tip number 1. Yes, you should still take a Medicare Part D drug plan even if you do not have any prescriptions. Sometimes I have people calling me thinking about dropping a plan, or when they're new to Medicare, should they take one? Here's the thing. If you don't take one timely when you're first eligible for Medicare and you decide later to sign up, you will have penalties. And they're penalties that will stay with you forever. So find a low monthly premium, grab that plan, and then in the future, it will be a good thing that you have it. Second, when you're choosing a plan, you want to look at the total out-of-pocket cost for the year, the premium plus all the copays. Lots of times people are calling me, well, this plan has a high deductible, or this plan's premium's way lower than the next premium. That's true, but you could choose a plan with a really low premium, but maybe your drugs aren't cost effective under that plan. So again, look at the total amount you're expected to spend for the year in helping you make a decision which is the best plan for you. 3, when you're choosing a plan, the details matter. So what do I mean by that? Whether you're doing it on your own or you're working with an agent, make sure you have selected the right drug. I can't tell you how many times I've been going through it with a client and we'll review it and they gave the wrong information initially, and we figure it out because the drug is looking crazy expensive or it's not expensive enough because it's been inputted wrong. So make sure, is it a capsule, is it a tablet, do you have the spelling right, is the dosage right? Those kind of factors. You also are thinking about the pharmacy you put in because you want to choose a plan. You want your pharmacy to be preferred with the plan that you've chosen. 4, and I love this one, I want you to remember that when you're on a plan, when you've chosen your plan, it's based on a snapshot of you the day that you enrolled in the plan. But what if your drugs change? Do not forget that you are going to be provided with a formulary, which is a fancy word for a drug list. And if you add drugs during the year, you want to show that formulary list to your doctors so they can choose cost-effective drugs under your plan, and it can make a big difference. 5, IRMA also applies to Medicare Part D. So in other words, when you're looking to enroll in Medicare, if you're a higher income earner, you know with Part B that you're going to pay more than the standard amount. There is also amounts that can be added on to your Part D premium if your income is in a higher threshold.